At Health Optimization Medicine and Practice, we care about foundational health biomarkers, foundational health principles, and optimizing for health rather than focusing on disease. And it doesn't mean that we don't think that disease exists. Of course it does. And I'm an internal medicine physician. I understand that disease is a big problem. But if you don't look at the foundational aspects of biology and you just start trying to treat or even find the root cause of illness, you often are missing the boat by not seeing that foundation. One of those big foundations is gut health, having an optimized gut. 80% of your immune system is in your gut. So if you have a leaky gut, if a gut is inflamed, then you're going to have a lot more inflammation in the body, not only in the gut, but also in the body, of course, but especially in the brain. You're going to allow things into the brain that shouldn't get there. And that's dangerous. And I see this all the time. And a classic example is when I give somebody a GABA supplement. GABA is too big to get across into the brain. And if it does, it's just about diagnostic that you have a leaky brain. And so what do? Well, I address the gut itself. And this is what we do at Health Optimization Medicine. We look at a gut microbiota assessment. We look at things like infection, dysbiosis, metabolic imbalance, maldigestion, and inflammation. And look at all those 5 pillars together. You can get a true sense of what's happening in someone's gut. And from there, you can create a whole profile of dietary changes, lifestyle changes, and supplements to help optimize somebody's system and hopefully seal up that gut. A big part of this is sympathetic overdrive. If somebody's in sympathetic fight or flight all the time, they're not going to be able to heal or digest anything, and their gut does get leaky. And I've seen this countless times. In fact, just recently on a patient that had been really having a hard time since she was 4 or 5 years old, and she's in her mid-40s. And she even admitted to me that she has never felt safe since that time. Her father was an alcoholic and things like that. And so if you don't address those kinds of things, they build up, and that the body keeps a score is a book for a reason, because it is true. But just from a story perspective, I remember one patient of mine, we were working on understanding some of her symptoms. And again, I wasn't focused on disease. I was focused on optimizing her health. And I checked her gut. We checked her gut, and she had a massively leaky gut. And so a lot of gut inflammation. And so the first thing we did was give the gut the fuel, the primary fuel that it needs, which is glutamine. Glutamine is the primary fuel of the small intestine. We just increased it slowly over several months, really. And I started giving her more supplementation for her gut, improving her diet, changing her lifestyle a little bit. And as her gut started to heal up, and we looked at something called a zonulin family peptide, which is a marker for gut integrity, which goes high when the gut is not having integrity. That number kept coming down and down and down. It really correlated with her symptomatic improvements. Her mood improved, her pain improved, her cognition overall improved, and she just felt better overall. And so this wasn't the only thing we did. We also looked at a metabolomic assessment. We looked at foods that she might be sensitive to, because that's really important. If somebody has food sensitivities, this could be because the gut's inflamed, or it could be that the foods are actually causing it. So in that case, I often remove the most likely foods that are causing issues. We change the diet around at least for 3 or 6 months, and then we reintroduce things over time. The goal really with health optimization medicine is not to be restrictive over time. It's actually to be able to be resilient when you're not being restrictive, but having an optimized gut, optimizing cellular biology is a true foundation of all.